I'm Debasis Basu from Meta Care Clinic, Kolkata. Cough primarily is of two types, wet and dry. The wet cough is a productive cough, which is actually expulsion of the mucus or phlegm. It's an attempt of the body to clear the airways of the irritants and the infections. Where a dry cough is a non-productive cough, which lacks the presence of mucus or phlegm. It is a persistent, nagging, irritating tickle in the throat without any expulsion of phlegm. Wet coughs are frequently associated with respiratory infections, allergies, environmental factors like pollution, smoking. Dry cough is actually triggered by factors like infections, maybe common cold, allergens again, asthma, acid reflux. In children, the common causes of cough are respiratory infections like RSV, respiratory syncytial virus, other common cold flu, allergies, exposure to irritants such as smoke, even secondary cigarette smoke, air pollution. Children, while in school or while returning in crowded school buses, they're often exposed to a load of virus, various germs all around. In older people, coughing may be associated with underlying, maybe serious medical conditions such as chronic obstructive pulmonary disease, COPD, pneumonia, heart failure, sleep apnea, and maybe rare cases of pulmonary embolism. What happens is, as you age, your immune system weakens. That makes you more susceptible to infections and other respiratory issues. Therefore, we need to identify the root cause